Hello, everyone. Thank you for tuning in. Welcome to Navigating Through Uncertain Times COVID-19 webinar. I'm Hannah Lee, the Gospel Care Director at Tapestry LA Church. I will be your moderator today. So as you are all aware, as a humanity, we're facing a historical time right now. Our world has been turned upside down due to coronavirus. Many of us have been quarantined and practicing social distancing since mid-March or so. This disease has affected us on multiple levels, like our daily functioning, schooling, employment, finances, our physical and mental health, our sense of autonomy or lack of, and our spirituality, and so much more. It's easy to get overwhelmed by the negative impacts coronavirus has had on the individual and societal level, but we must also consider what God is doing in the midst. God will not leave us in this current state. Jeremiah 30:17 says, "For I will restore health to you, and your wounds I will heal, declares the Lord." In all the times of distress in Scripture, God has pursued humanity's restoration and wholeness, and He is working towards that even now as we speak. So, how do we become attentive to His restoration pursuit during this pandemic? We need to consider all the levels of impact COVID-19 has on our lives and equip ourselves with life-giving wisdom and strategies to allow God's healing work to flow in our lives. This is the reason why we created this webinar. We brought together professionals from the medical, financial, spiritual, and mental health fields to address questions and concerns you may have regarding COVID-19. We know that you have all been already bombarded and flooded with an overwhelming amount of content on the news and media. But what you have seen has not always been accurate or helpful, depending on the source. It may have actually created more anxiety and fear. So we want to use this platform to give evidence-based truths so that you are properly informed. We must also remember that this pandemic is temporary, so we will discuss how to prepare for the aftermath of COVID-19. It's God's desire to undo the damages of this pandemic and restore the fortunes of His people described in Jeremiah. This phrase, restoring the fortunes of His people, gets repeated all over Psalms and Jeremiah. It's also in Deuteronomy, Lamentations, Job, Ezekiel, and many other books in the Bible. And this idea of fortunes isn't limited to salvation, but also the restoration of all creation. So let's talk about how to ready ourselves for that so that we can seize all the goodness God brings as He restores the earth. So let's begin by introducing you, the viewers, to our panelists. We first have our medical expert, Dr. Michael Kim. He is an assistant professor of anesthesiology and critical care at Keck USC School of Medicine. He is also a medical director of perioperative services and value improvement office. And then next we have my handsome husband over here and financial expert, Benjamin Lee. He is a managing director in wealth management of investments in the Los Angeles area with experience in the financial services industry for 20 years. And then we'll also have Pastor Charles Cho, our lead pastor at Tapestry LA Church, with pastoral ministry experience for over 20 years. He'll join us as our spiritual expert. And then finally, we have our mental health experts, Tiffany Kwong. She is an adjunct professor in the Masters of Social Work program at Azusa Pacific University, and also a behavioral health program manager at Herald Christian Health Center. And then some of you may know her as Hannah O, but professionally she goes by Hannah Lee. She is our licensed clinical psychologist and tenured faculty at Cal Poly Pomona's Counseling and Psychological Services. Welcome, panelists. Thank you guys for joining us. Just a disclaimer to the viewers that these professionals do not speak on behalf of every professional in their field who may have varying opinions and advice. But as you can see, these experts come with credible and esteemed backgrounds, so it's a great privilege to hear from them. Also, I want to thank you to those who submitted questions. The panelists have chosen the most common types of questions to address in their limited time. Panelists, you guys can chime in whenever. You can ask furthering questions and dialogue with each expert who's presenting. Okay, so let's begin. We're going to start with Dr. Mike. Hi, Dr. Mike. Are you there?
Hello. Yeah, I'm here.
Hi. Okay. So the first question is, as quarantine and shelter-in-place order gets lifted, people will have to resume the usual health care they receive with their providers. So what are some safety precautions you think that will come out of COVID that will continue to remain in our usual experience as with ambulatory and acute settings?
Great. I feel like this question is geared toward the work that I'm currently doing. So just to give you an example of what we've been doing in the either outpatient and acute settings for space. So we've been very aware of the social distancing. So when you come to the clinic, there will probably be a 6-foot distancing kind of markers that get lined up prior to you coming into the space. In the outpatient surgery world, we've done the same thing. We tried to space it out. So when you check in, there's a 6-foot gap between you and the person checking in front of you. We tried to streamline the process so there is minimal patient to patient visitor activity. So we're one of the first hospitals that actually limited the amount of visitors that were able to come into the hospital. So some of that gets a little nerve-wracking, I think, for some of the patients, which I totally understand. But also, we're trying to limit just the overall person exposure to every single patient that's in there. So we're trying to keep that safe. And then even in the kind of waiting room area, we've also decreased the amount of space that's there. So we've either guarded off chairs or we've taken chairs out. So there's not large groups of people sitting around in that space. We've had to change a lot of that practice from the hospital side, right? So a lot of, we've been revamping the way that we do our visits. A lot of it's been telemedicine. And then when it comes to also discharging patients from the acute ambulatory setting in terms of either the outpatient space or after you've had surgery, we had to change that practice as well. So there's a lot of different, COVID has definitely changed the way we've done practice. It's put a lot of stress on the system. One of the big things too that we've seen is that when patients do come into the ICU, if they're COVID positive or we just had to limit that space. So there's definitely been a level of angst when patients enter the hospital that's been a little bit heightened because of COVID-19. When it comes to these new safety precautions, the question was, do you think it will come out of COVID-19 that will continue to remain in our usual experience? Outside of the hospital and ambulatory space, I think I envision kind of two scenarios. One case, we'll find a reliable treatment for COVID that decreases the mortality of this virus, and or will commercially available vaccine that is widely available. Then I hope that we can just go back to the way that we do things. But in terms of just normal hygiene practices, we may have people fearful and hesitant to give up the security of the mask for some time, which I think is totally valid. And if we ever find a way to treat or prevent this disease, then we have no reason we cannot go back to the way things were before COVID-19. I personally have done a lot more hand washing. I think I've never washed my hands this many times ever in my life. Everywhere I go, whenever I see the Purell foaming or the alcohol, whatever it is, I'm always doing that. And then, I'll go back. The other scenario that I see is that there's this fear of transmission will just continue over time. And, it'll just be a normal space that we live in. I think some of the other pandemics or things that have happened in the past, we just weren't privy to it, right? So swine flu, Ebola, there's been a lot of these things that come up. And over time, we figured out a way to kind of temporize that. And we kind of live in that space now. So, hopefully it'll loosen up a little bit so that we're not doing temperature checks at every single entrance. We'll likely see it more and more, this continued use of masks in the ambulatory space as well as in urgent care ER settings, which I think is totally appropriate. And, hopefully after time, as this different seasons come across, we'll be able to, the other medical experts out there will give us more advice and the healthcare experts will be able to tell us exactly what needs to happen.
I know you just briefly talked about like televisits.
Yeah.
How do you think that would kind of affect like the quality of care that people would receive?
That's to be seen. I think the one thing that I personally don't do is I don't do a lot of telemedicine visits. And I can see there's a level of angst, but I think the level of angst comes from both sides. One is that as a physician, you want to go out there. This is not just as a doc, right? This is as a physician, nurse practitioner, social worker, whatever it is, right? Whatever your profession is, nurse that sees people, NPs, PAs, APPs. There's definitely that loss of touch, I think, that we're all used to as physicians or as clinicians. However, I think of it the other way around. There's probably a level of angst also comes from the patient side of coming in, right? There's this level of fear of coming in and saying, hey, you know what, if I come into the hospital where people are sick or maybe sick, maybe I will also get sick. So with the telemedicine visit, I think that it has decreased that level of angst as well. And also, COVID-19 is really, if you were ever in the dark ages of medicine, it's forced you to ramp up, right? So, technology and all this way of communication, if you weren't ready for it, it's forced you to be ready for it. And that's on both sides of being able to take care of patients, the business aspect of medicine. Just all of that has just kind of come into fruition pretty quickly for all of us. I think it's difficult. I think there's a lot of limitations to the telemedicine visit, but there's also a lot of benefits, right? The check-in process has decreased, the ability and the availability of physicians has increased. For a lot of us, at least talking to patients, there's one thing I think that it definitely has is that there's a level of communication now that we have that has definitely decreased some of that angst for our patients. So I think telemedicine has its positives as well as its negatives. But if you need to be seen in the clinic or you need to be seen in the hospital, nothing should stop you from coming in and getting the appropriate care that you need.
Mm-hmm. And I know there was a question about parents of preemies and how we can keep our young safe during this pandemic. What are some proper measures that they can take to keep their children safe?
Yeah. Where's my wife? Eunice.
I know.
so if you don't know, my wife's a neonatologist. So this is her kind of expertise. I had to ask her this question and say, her answer was, if they are premature by many weeks, then the answer is yes, right? Is that how long do parents whose lungs haven't had fully developed at birth have to be careful? That one I don't think I could give you an exact answer for, except for that I think the same precautions, regardless if it was COVID-19 or not, those are the same precautions that you should take as if it was just a full term, or do we have to be careful for longer? I think the same sensitivities that come across for all of this is that you should just take the same precaution that you're currently taking with those babies, and the same extra precautions that if they were preemies, to do the same for those. So, at some point at its peak in Los Angeles, I was wearing a mask even inside the house. My mom was wearing a mask. My dad was wearing a mask. We'd go out and we'd all be wearing masks while we're walking through the streets. We're definitely, whatever Trader Joe's is doing now, we were doing, 4 weeks ago, which is wiping down the bars. We were spraying whatever we can on our hands. I take the foam and put it across the handlebar and wipe the side. So, things like that we've definitely taken into consideration. I think as the numbers change, as we fight this pandemic and we're active in it, I think that some of those precautions will loosen up. But for now, I think wearing a mask, keeping your hands clean, maybe even Pureling a little bit more. There's a couple of things that I've learned watching a video coming out of some experts in Colombia. This virus is very susceptible to the Purell. So, even a drop to wash your hands with frequently is a great thing for you and your family.
Yeah, you pretty much answered our next question, which is it bad to is it bad to do things like grocery shopping, and is it safe to go outside, right? For walking, the precautions that you already suggested with mask wearing and Purelling and all that, is that sufficient?
Yeah, I think, I saw this great correlation or some analogy to this that I thought was interesting. Actually, I don't want to go into it. That's probably not appropriate. But anyways, had to do with peeing. So I apologize. But, the thing is, the mask, if everyone's wearing it, right, it protects you, but it also protects everyone else around you, right? So as long as we're sharing that same, including the social distancing, as long as we're sharing all of that, I think we're in an okay space. What's great is to see all of, it actually really touches me, because I've seen that society has come together to really help everybody out, right? We've looked around, and when it comes to even just going to the grocery store, they're out there spraying everything down for you, right? when you go to different places, they're wiping down. There's a team that actually goes around and wipes things down. If you go to Whole Foods, there's people wiping things down. If you go to Ralph's, there's people wiping things down. And there's been this kind of society's just really taken it together to kind of collectively come together and really help us do our normally day of living things, and really help and support all of us. So with that, on top of hand washing, on top of the wearing the mask, as well as the social distancing, I think it's okay to go out and shop. I think it's definitely safe to go out there and get some fresh air. Look, I'm doing a lot more walking in the neighborhood than I've ever done. It's probably the one chance that I get to spend time with my family outside of being kind of cooped up in the house all the time. I'm not a big fan of the gloves because I think people forget that when you wear gloves, you probably don't Purell, right? So you can grab all these hundreds of things that you're touching all the time. Hopefully you're not going to the bathroom with your gloves on, but you use the glove, you go touch something, you go touch something else, and then you just do your normal things that you would without taking some of that precaution, because it's not natural to Purell with gloves on, right? Outside of maybe some healthcare professionals. So I think the safest thing really is to just keep on Purell and keep the social distancing, use masks, and use those things liberally. I think right now in this kind of hyper acute phase, I think that's the appropriate thing to do.
So as we're like talking about getting the stay-at-home order lifted, and we start seeing more people out, do we just keep following the same precautionary measures, or is there anything we should amp up or?
No, I think we've done a great job. I really think we've done a great job. I think, there's some things that in Los Angeles that we have that we're lucky that we don't have in other cities like New York, or we didn't have big events. There's a couple of huge events that got canceled before we got put on this kind of stay-at-home situation. There was a huge conference that happens in Anaheim. There was a huge conference in the Midwest that they all canceled. I mean, Arnold Schwarzenegger canceled his huge conference. So there's a lot of things that ended up coming across that we were very lucky with. And then number two too is that we didn't have a very fierce winter, right? I mean, it was still like 90 degrees in January. So when it's raining and it's cold and your immune system kind of takes a little bit of a hit, and then on top of that, the COVID-19 comes across, I think it can be pretty vicious. And we're lucky to not have a really cramped public transportation system. California kind of did the stay-at-home kind of stuff a little bit earlier, and we were sitting around in 90-degree heat in the middle of February, in the middle of March, right? So we got lucky that way. But I think the same things that we're currently doing as things start to open up, I think just our normal inclination to stay in that 6 foot of the social distancing, wearing the mask, Purelling, I think that's going to be a commonplace for quite some time. And even if someone says stop doing that, well, I think it's become part of our kind of social norm now to have the Purell and to wash hands and to keep some social distancing there. And other places like China and Korea have done mask wearing for quite some time, and I think that we'll probably end up mimicking some form of that for a little bit.
Does anybody have any questions to ask Mike or input before we move on to Ben?
Yeah, I have a quick question, Dr. Mike. So if we have flu-like symptoms, let's say we're young, we're healthy, we're 20, 30 years old, we got flu-like symptoms, do we just stay home and try to fight it like a regular flu? Or do you think we should go to Kaiser, go see our doctor, go get tested, do all that, and then what are your thoughts about that? Because what do we do once we have those, like a fever, and all these symptoms going on in our house?
Sure. I think the situation has changed differently, right? I mean, if it was normal flu season, sure, duke it out. Probably stay away from your family. But now I think because of the current situation in the state that we're in, I'd probably go get tested, right? Because the questions that are going to get asked when you walk into the ER, to the urgent care, are probably one of this slew of questions, right? One is, are you symptomatic? And they're going to ask you, have you had a fever? Have you been around somebody who's potentially COVID positive? Before this all happened, the question was, have you traveled recently, right? Which might still be a very, very valid question. Have you traveled from New York, the Pacific Northwest, or Asia at any given time? Have you felt short of breath, right? Are you feeling weakness? So all these same questions will come up, and likely if you are having some form of flu symptom, you'll have a yes to that question. Yeah. I'd go get tested because the treatment and the outlook for both of those is very, very different, despite what age you are, right? Okay. So I would go get tested.
Anybody else? All right. Thank you, Dr. Mike.
Of course.
All right. Sounds good. Okay, so we're going to move on to Ben. As our financial expert, can you give us a brief overview of the current economy and capital markets?
So the economy, just wanted to share, the last time we had a recession was back in 2007, 8, and 9. So it's been almost 11 years since our last recession. Recessions are normal. I get this question all the time. They happen about once every 5 to 7 years. We have a pullback in the market once every 12 months. But this is the first time that we've ever dealt with anything like this before. We've never dealt with 20% unemployment as a country. Just to give you some comparisons, in the 07 to 09 recession, which was the worst recession of our lifetime, unemployment jumped to about 10% at that time. So we're dealing with double-digit unemployment. We've never seen oil at $0 a barrel, and we've never seen interest rates at 0% in our lifetime. So we're dealing with a lot of things we've never dealt with, plus this pandemic that seems like it's going to be far worse than AIDS and MERS and these other types of things we've dealt with in the past. So we call this in our field the artificial recession because it wasn't caused by greed like in 07, 09. It was caused by a forced shutdown by the government, which was obviously from the COVID-19. But they literally forced every business in America to close doors and to stay home. So it's nobody's fault, right? So that's why the government is coming out, throwing everything they have at the economy. At the end of this, we're expecting them to use between $4 and $5 trillion of printing money and throwing it into the economy to provide liquidity, to provide backstops, and they're pretty much supporting every single market out there right now in every sector you can think of. So let me just give you a quick overview of the U.S. economy. Okay, we're going to leave the global economy alone for now. The U.S. economy is about 22 trillion in size. We're the number one economy in the world still. China is right behind us. Last year, our GDP, which is our gross domestic product, that's just basically the total output of all of the goods and services in the country. So it's a way that we can measure the economic health of this country. Was at a positive 3% last year on average. Just to give you some recent numbers of the first quarter of 2020, that GDP number dropped to 4.8, minus 4.8. So that's almost an 8-point swing just in a matter of a few months. The GDP number is mainly comprised of consumer spending. That's about 70% of the GDP number. So it's pretty obvious. We're not going out, we're not opening up our wallets, we're not spending as much. So that has shrunken dramatically. The bad news is that the worst is not over yet. We expect the second quarter of this year, which is, we expect it to be a lot worse. We think that it could go down to as far as minus 20% from here. So we think that the second quarter is going to be a lot worse than the first quarter of this year. And then we think from the third quarter on, it's going to start to improve. And then by the fourth quarter of this year, we should be in much better shape than we are now. Just to kind of explain inflation, a lot of questions about this. It's basically the general increase of prices around us. So we don't see any issues with inflation in the near term, even with all the money printing going on, just because there's no activity going on. So we think inflation is going to stay around 2-3%, which is normal and healthy. But in the intermediate and long term, which could be 3, 5, 7 years out, we think there's going to be a huge problem with inflation. So that's something else we can talk about down the road. Interest rates, that's another thing that people call in about all the time. Interest rates have been dropping for 30 years straight. Okay, we finally hit the bottom. We're now at 0% interest rates. And that applies to short-term rates along with long-term rates. And this is important to the average American or even young people like our church, is because for older people, it's bad, because if you're retiring, you're living off this income, this fixed income, you're relying on interest from the bank to pay you for retirement income. You're living off pensions, you're living off these annuities. If we're at 0%, your income's going to be very, very small. So it's a big problem in our world. For young people, it depends on what you're trying to accomplish. But just remember, if interest rates are at 0%, it's a good thing for people that want to borrow money at this time. If you want to refinance or borrow, that's what it's doing. The government is trying to spur lending on right now and trying to prop up the economy by dropping the interest rates all the way down to 0%. The unemployment, this is a huge discussion. Before going into COVID-19, all the way until January of this year, unemployment was at about 3.8%, which is 50-year lows, okay? All of a sudden, 6 months later, we're dealing with unemployment closer to 15 to 20% unemployment. So a huge issue right now that we're dealing with. The government, like I said, has spent almost $4 to $5 trillion already. And just a rule of thumb, there's going to be a major slowdown as the government gets bigger and bigger in their balance sheet. People ask, why has the stock market rebounded recently? It's gone up 30%, Ben, in the last 4 weeks, while the data is getting uglier and uglier. What's going on? So just rule of thumb is the stock market or the capital markets usually looks 4 to 6 months down the road. They don't look at the economy, what it looks like right now, but they're always forecasting and forward looking. So that's why they're optimistic. When Trump says he's going to start reopening and the governors are saying we're going to start to reopen, I think there are 7 or 8 states that are opening soon. That provides a lot of optimism. There's a lot of companies coming out right now like Pfizer and some of these other doctors that we've been talking to saying that there should be some sort of positive news on a vaccine by this fall. So that really added to a lot of the euphoria in the markets recently.
At home, usually I check out whenever you talk about finances, but this was really interesting.
Thank you.
All right, so when should we expect recovery, and are there opportunities coming?
So the good news is yes, there is going to be a recovery. There always is whenever there's an economic recession or a downfall in the market. It's very hard to see, but there will be one. We hoped in January that it would be a V-shaped recovery, but obviously that's not happening. So we think that it's going to be more of a U-shaped recovery.
So does that mean that's going to be slower?
Slow, it's going to be sluggish. Think about even when the vaccine comes. Think about when the antibodies come. You think that people are still going to get on a plane? You think they're going to go to the movie theaters? I don't think so. I think a lot of the older people are still going to stay home. And I think that people are going to be very cautious even after that happens. But the good news is, yeah, we think it's going to be a slow recovery. Our best estimate at this point is that about 12 to 18 months from now, things should be almost back to normal. 2 important factors to look out for is when is the economy going to open? When are the businesses going to be able to open? And look at consumer demand. Are people spending money? Are people opening up their wallets? Those are the 2 most important factors for the economy and for the markets.
Okay, so how could we prepare ourselves for this challenging job market, particularly for the college graduates and this unemployment or underemployment?
So if you're staying at home and you have some extra time like we all do, hopefully, okay, besides the moms out there, the first thing I would do is just do a budget exercise. Do it by yourself, do it with your spouse, do it even with your children. Do a budget exercise, take a look at where all of your expenses and expenditures are going. And my advice has always been, the last 5 talks is cut the excess fat out. Cut it out. I mean, I did a review a few months ago, and my wife and I have fought over this. It's ridiculous, but she wants to continue to pay for restoration hardware, right? And we haven't been there in 3 years, right? So I'm trying to get her to cut that out and let's cancel it. Let's look at all of our subscriptions. Let's look at all the things that we're spending money on. Gym memberships, Spotify. Most of the people I know have 4 streaming services. All these types of things you can cut out little by little, and I think it's a good time to do that. The rainy day fund. I know Dave Ramsey screams about this all the time, but this is the time to start saving if you can. If you don't have a rainy day fund, this is what you can do. you can actually defer most of everything on your budget. Think about your mortgage, think about your car payments, think about your credit cards and your student loans. You can virtually defer all of these payments for the next 4 to 6 months. That'll give you some time to save up for a rainy day fund. But the recommendation is about 6 months. Review your investments and rebalance right now. When's the last time you looked at your 401k, or you looked at your college savings plan, or maybe you have an insurance policy? Take a look at that. It's probably out of sync right now because the market has come down, but rebalance that and just recalibrate your allocation. If you need help with that, you can talk to an advisor or someone that can help you with the investments there, but keep contributing. People ask me, should I stop? And I say, well, if you didn't lose your job, or if you're not in financial hardship, why would you stop? And so my advice would be continue to buy and invest and continue to save in the markets. Right now is actually a better time to invest because the market prices have come down. So it's like buying things on sale, right? You want to buy it when it comes down. This is a great time to do that. Review all of your debt, all of your loans. Like I said, you can defer most of that stuff right now. You can try to refinance if possible. A lot of the big banks have stopped doing that as of yesterday, actually, but I would call your bank and just see if they can still refinance or consolidate some of your loan debt and defer it if you can. The last thing that I've been dealing with, this is for people that are a little bit older, I would say 35, 40 or over. Review your estate documents. If you're a family, if you're a parent, make sure you have a living will set up. You can set one up online really quickly. You can meet with an attorney, set up a living will. The important thing about that is you want to make sure that if anything happens to you, all of your assets are going to the correct people. And also you can assign a guardianship on the living will. If something happens to you, God forbid, that someone will be there to take care of your young kids. Look at setting up a financial power of attorney. If you are helping your parents out or your elderly parents, if they're sick, make sure that you have the power of attorney there. Most of us could benefit from having a living trust. This is for people that have a house, that own a business, that have substantial assets or complex issues. You want to have a living trust to avoid probate, and also having healthcare directives. This is important. People need to be able to make decisions. Talk to the doctors, nurses, pharmacists. I'm doing that right now for my parents, and I set up a health directive so they know exactly who to talk to right now. Right now would be a good time to just check the titles and beneficiaries on all of your accounts. That's always good to do once every few years. And just some personal advice is try not to watch the news too much. The news drives you crazy. I mean, it drives a lot of hopelessness. So that's one of the tips that I want to share is don't get glued to watching the news all day long. It's going to bring you down and cause a lot of, you're going to have to go see Tiffany and Hannah if you keep on watching the news all the time. So,
so how does that apply for those who might have lost their job?
So if you've lost your job, obviously, get the unemployment. Okay, so that is for at least 4 months or so. The good thing about that is the government has kind of boosted that up. So I've seen it as high as $49,000 a year. The bad thing about that is that it's causing a lot of people to get lazy. If I'm entry level, if I'm making $30,000 a year and I'm getting $49,000 from the government, why would I be enticed to get up and find a new job or find employment when I have 4 months or maybe 6 months if I can just lay back and chill, right? So that is something that a lot of people are talking about. The younger people are getting pretty lackadaisical if they're receiving all these benefits right now. But what I would do is I would get ready for the new economy. Everything's going to change 6 to 12 months from now. This job market is going to become more challenging. We had roughly 30 million people apply for unemployment benefits recently. That's almost 20% of all the working class Americans. It's going to become more fierce out there, more competitive. So what I would do is, if you have time at home right now, I would develop your skill sets. Right now, make a list on the left of the things that you're good at maybe, and maybe the skill sets you can bring to the table. And on the other column, make a wish list of things that you wish that you can do better. I don't know if it's learning a language, getting better with technology, maybe learning some conflict resolution skills. These are just a few examples. I mean, in my field as a financial advisor, we're always looking for people that can build relationships quickly. You got to be able to start a conversation. You got to be very personable, trustworthy. These are some of the traits that we're looking for. Right now also would be a great time to start thinking about multiple streams of income. And I know that it's easier said than done, but just go online, go on YouTube, check out what other people are doing. You could still earn, maybe 40, 50 bucks an hour tutoring, or, you could do some side jobs and just, you can come to my house and watch my kids. I'll pay you 50 bucks an hour. You know what I mean? So just start thinking of ways of diversifying your income stream so that you can provide a cushion. Okay. One of the things that we rely on is our investments produce dividends and income for us. And so as an example, let's say you put aside, accumulate $100,000, let's just say as an example, we get about $4,000 to $5,000 a year in interest off of that income investment. And we use that to pay our bills. We use that to pay for all of our aftercare programs, our tutoring costs, things of that nature. And so that kind of just pays for itself and it provides income for us.
Do you have any advice for college graduates?
Yeah, I mean, to be honest, I haven't been to an interview or in 12 years, but some of the things that I would think about doing is, obviously take a look at your resume and not only send it and mass blast it and send it to employers, but send it to your friends that already have jobs. These are the people that are already working in that company. They can put your resume or get you to the front of the line. They can put in a good referral for you. I think that is a great way to get a job. Another thing is look for centers of influence in your life. Look for people in your Rolodex or your phone book that can really kind of, share that you have a need. The first person I can think of is go to your local pastor, go to Pastor Charles, Pastor Peter. These guys have massive influence. They know tons of people and they love to connect people, especially when it comes to jobs or getting married, right? Also, touch up on your interview skills. Communication is huge. It's okay to smile. They wanna have a conversation in the interview. They don't want someone that's too uptight. Work on your body language. Be good at storytelling. These are some traits that I hear a lot of what employers are looking for at this point.
Do you know how this market is affecting like student loans or repaying loans or anything like
The
that?
student loans, yeah, those can all be deferred right now, as far as I know. You can defer all of your loans right now.
Without any penalty?
Yeah, without penalties, interest accruing up to about 6 months. Pretty much everything you can think of, you can defer. Even if you're renting an apartment, you can have a conversation with your landlord. People that are, landlords are they're hurting right now. They're calling their banks, they're calling us every day saying my renters aren't paying, my tenants aren't paying me. We need to revise our relationship and our loan. So I think that's something to keep in mind as well.
Any last minute things that you want to share?
Yeah, let's go to the picture right here. This is meant to be kind of funny, but it's not funny. Is that up?
Yeah.
Okay, it's called 20-Year-Old Money Mistakes. Okay. Just take a look at this. I know that we don't have 20-year-olds, in this meeting right now, but there could be at our church or whatnot. But there's a lot of partying, expensive dates, a new bike, poor credit score, $100 sneakers, eating out. They don't budget. There's no budget, student loans, and no savings. Okay, so just keep these things in mind. And then let's just go to the last slide. And this is basically just a few of the apps that I use. Mint.com, it just helps me with my budgeting, my personal finances. It keeps track of all my money for me. Bankrate.com is just a website that you can go to for all the interest rates and all the financial calculators if you need that. And I go on Bloomberg and, once or twice a day just to check the news and the investments as well.
Did anybody in our panelists have any questions for Ben?
Ben, I think you need to clarify what a Rolodex is.
Sorry, that's 80s. Yeah. Just go on your phone and look at your contacts.
Got it.
Anyone else? You good? Okay. Thank you. Thank you. All right. So, PC, you ready?
Sure.
Okay.
Let's do this.
So,
By the way, that was amazing, both Mike and Ben. Such helpful suggestions. Yeah, I can apply that for myself too. Thanks.
such a pastor. So nice.
I love my pastor.
Okay, so we had a question that was submitted. I'm going to read it to you, okay? It says, I don't know what to do with all this anger I have. I'm a nurse working in the hospital and seeing people incubated. But to see people protesting and not practicing social distancing, and the government and businesses wanting to reconvene early, I don't know how to not be angry, mean, and bitter. Especially as these governors and our president claims to be Christian, how can they tell people to protest and gather? It's not even common sense. What is our perspective as Christians supposed to be?
That's a great question. And really, I understand you being a frontline worker, and every time you're out there, you're risking your life fighting this invisible enemy. And we know that many of your colleagues have paid the ultimate price trying to keep the public safe. And really, we owe you and all the other frontline workers a debt of gratitude. And I have to say, like you, I have some concerns when I watch on the news, the different people, different states that are protesting. My immediate reaction is to say how ignorant and selfish, not to mention how it's so politicized. We have our president, and he's sort of fighting our governors, and we have the red states and the blue states. It's CNN or it's Fox News. There was a little bit of hope, maybe the beginning of this crisis, that somehow this would bring our nation together and restore some sense of shared national pride, or just a shared destiny that we have together. That doesn't seem likely. It seems to get worse every day. Now the question is, as a follower of Christ, how are we to feel about people who are acting this way? Of course, anger and dismay are very natural, and sure, that's something that you should feel at the moment. But I think you and I would agree that that's not always most helpful if we stay there. I don't know if you've noticed, like on the back of your dollar bill, we actually have this national model that people don't really know about. It's a traditional U.S. national model. It's in Latin, and it reads E pluribus unum, which means out of many, one. And that was essentially the aim of these United States, to be one, even as they were many and different. And really, this present time, that just seems like a pipe dream in so many ways. And to be honest, I don't even know if that should be our goal. To try to be one in terms of being all the same, of the same mind, of the same opinion, is not feasible, nor is it truly true to what I believe America stands for. There's a book that I've been reading that's been very helpful. I'm just going to point it out to you. It's Confident Pluralism. It's by John Inazu, a half Japanese man, professor, lawyer. And I love this phrase, this confident pluralism, and I want to just commend that book to you. I think it's especially helpful to read before you actually go to the polls this November. But this idea of being confident, the need to hang on to our deeply held beliefs and convictions. But because we live in a pluralistic society, that means that our inclusion by necessity needs to include some level of dissent. That's by definition what it means to live in the midst of pluralism. So to the matter that concerns us in this present moment, why are some people taking the pandemic so lightly? Don't they know that it's going to kill people, that there are dying and sick in the hospitals that's overwhelming our doctors and nurses. Don't they know that they're actually putting people in danger? And I think I think for the most part people do. There's a few who think this is all sort of a conspiracy, but I think they don't need any sort of airwave or attention. But we're talking about a dissenting opinion at this present moment. People who are saying, I need to go to work. I need to make money. I have kids. I have family to feed. I have rent that's due. This is not sustainable. We need to get back to work. That would be a dissenting opinion. By all polls, that would be. So my point is simple. The quarantine isn't necessarily felt the same way by all the same way for all people. For some of us, actually this hasn't hit us that hard. It's actually given us a chance to slow down, to do some reflection, and even reconnect with family, and to work from your homes, which is a privilege. But for others of us, this has really become a desperate time of crisis, and for different reasons. For some of us who are on the front lines, we're terrified of getting infected and somehow bringing this home. And it makes us angry every time we think about it. And then there are others of us who are terrified for different reasons. You have mounting bills. You have rent that's due. You have a family to feed. You have family to go and visit. And you worry about the future. So all I'm really saying is that this is an opportunity to consider what the United States really stands for. And that in this place that we call our nation, that there are both people who are wanting to kill people who break quarantine, and there are people who insist we have to break it, that it's our constitutional right to work. Others of us are getting very angry, and there are others of us who are getting angry for different reasons. Now, this is where the follower of Christ comes in. We live by the values of what we call the kingdom of God. Atop of that kingdom is the values of humility, kindness, and love. In fact, I would argue in our society that's defined by self-assertion and our rights, I believe that we Christians uniquely are equipped to deal with this challenging moment. We can remain resolved to our convictions that life is most important, that we're all made in the image of God, whether old or young, no matter what the race might be, rich or poor, that each of us have right to protection and safety and life. But at the same time, the values of the kingdom demand that we demonstrate this conviction that we have, this long-held belief, by being loving, by being humble, and by being kind. That we advance the kingdom of God, the kingdom of life, by loving others, by remaining humble and even teachable, and by being kind even to people who are against us. So as we pray, let God, let your will be done as it is here on earth as it is in heaven. Let's not actually forget that is not a pipe dream. That was something that Jesus taught us to pray. And in a real way, heaven does come to earth when we refuse to villainize people who are different from us, all the while showing the way of life by being humble, by being kind, and being loving to all of our neighbors. So this is an opportunity. Although we didn't choose this opportunity, we have a chance to show our non-believing friends and the dissenting voices in our culture that there is a way to disagree, that we can be confident, that we can be confident with our beliefs, but at the same time, we can still demonstrate the love of Christ to them. So I'm hoping that, especially as nurses and doctors who are risking your life to go in every day, to see that there are different types of pressure points that we're experiencing and different kinds of stress and fears that we are engaged with. And I'm sure our doctors, psychologists will speak a little bit more to that. But I just wanted to speak a little bit about the values of the kingdom, the way we are to disagree with people, and the way we're called to love and be gentle and kind even when we disagree with them.
I mean, that's like such a hard place to be in when you feel justified in your anger and you see, the way, systematically things are not, working the way that it should. And then that juxtaposition of like we're called to reflect love. What's like one practical thing that you might do to help you shift over to, acting out of love?
I would say the most practical and maybe the most valuable thing we can do with somebody we disagree with is to just listen, to not just jump to some defense or rebuttal. Like listening with the rebuttal in mind is not really listening. It's to really put yourself in the person's shoes and to try to understand where they're coming from, what their fears might be, and to consider why they may be making sort of the statements that they are, or being as outrageous as they may be. What's causing that fear, those worries and those concerns, and to being able to identify with that, because we feel that the common humanity that we have, that we can place ourselves in their shoes, that we can truly understand that we all share in some ways similar fears, just in different expressions. So just the ability to listen to like people you disagree with, I think that's a lost art, and we need to recover that. And Christians can lead the way.
I'm imagining Mike. You could kind of identify with this person, this nurse. When you feel angry as a frontline worker, what's something that helps kind of you understand that anger?
I think the latest thing that I've done is, when you're dealing with multiple people and multiple personalities and this complex situation that we're currently in, I think everybody has their viewpoint, and in their own respective world, they're right. And that's okay. And I think I turn around and I have to listen to that. Is there an obvious fear? I don't know if I've ever had anger or hatred towards somebody because they're outside doing something. But I've definitely gotten pretty irked at my parents when they decided they want to go out and need to go shopping, or and then they need to get out. But there's a lot of that, I think, that's just really pent up inside, and we're in a world that we've never been in, right? Where we've been told by leaders, we've been told by our whatever political stance you come from, those leaders have told you to stay inside, and there's other people who I think there's some of us that the best situation that I can think about is if you currently have a job and you're doing okay. The other flip side of that is there's a large group of people out there that are in insane fear about what's coming up next. And I cannot say that my reaction to the current situation would be the same if I was in their shoes. So I understand that, and I try to, in terms of like the entire society's safety. Look, if we can't stay cooped up forever, right? So that's one. Two is, if you're out there, I think that as time goes along, we're going to have to learn how to live in this space. So do I think people should be running around and going to the beach right now? I don't necessarily agree with that. Does it make me question people's kind of motives? Sure. But I think all I can do at that point is really go, hey, look, like, just don't try to be mindful of what the people that are around you that's happening, right? Because the majority of people that are actually showing up that I've seen in the hospital, they're all in their 80s, and look, they've got other comorbidities. The young people, who knows if you're walking around with the pneumonia and somebody gets you and you happen to contract the coronavirus, and that's when people start getting sick. So if we can be a little bit more patient, I mean, yes, the weather was fantastic last weekend. Everyone wanted to go to the beach, but if you can just be mindful for another week or two, another 3 weeks, and really let us get to the point where we're all safe for the better good of everybody, let's do that. And yes, I mean, for some people who are out there actively fighting this look, I look at nurses, I look at PTOT, I look at the respiratory therapists that are going in and out of these rooms consistently. That's the current world that they live in. And I think they have every right to be angry at some people who are not trying to take the rest of the world into consideration for their safety. So, look, we're all in a very trying time, and some of the reaction is appropriate. Some of the reaction is okay. To say that we should live in that space the entire time, I don't think that's correct. But you know, it's look. That's why we're doing this panel right now, right? Is for us to be able to talk it out, for us to be able to reason, for us to get some answers.
Yeah.
And sometimes there will be no answers, and that's okay.
Yeah. And it's not easy. It's not easy to be in her shoes, but I think, you know, like PC said, how can we reflect Christ, and how can we, you know, really respond differently than the rest of the world? I think that is a huge way to even show this lost world where we can hope in, and share a little bit of the gospel love to them. So, PC, the next question is, in the Old Testament, it seems that plagues were sent by God to punish the people, and they ended when the people cried out to God. So how should we be responding to this plague today? Should we be telling people to cry out to God?
This is such an age-old question, isn't it? Mike, you might remember the big San Francisco earthquake that happened in 1989, I think. During that time, Fuller Seminary's president, Richard Mao, was invited to preach at a church in California. And Mao sensed that the people there wanted an answer to why there was such a devastating earthquake. And many there, he sensed, was wanting Mao to say something like, this is God's punishment against San Francisco for having such a large gay population. Instead, Mao decided that he would choose 1 Kings 19 as his text. And some of you might know the story of Elijah. After a big battle, he was a little depressed, and he found himself in a cave. And he's waiting for God to come. And we read that very famous line where it says God was not in the earthquake. Remember that in the Bible, right? When something devastating happens, we, as humanity, we have this tendency to say, God is punishing us. This has happened in the Black Death. Can you imagine a third of your neighbors, like a third of Europe was destroyed from the Black Death in the 14th century? So people had to sort of like blaming God and blaming other people, especially the Jews, but they thought it was a punishment. That happened about 100 years ago with the Spanish plague that killed 50 million people. After 9/11, we heard the same sentiments everywhere. But I'm not sure if that's probably the best or the most helpful way to look at a pandemic. For one, we're told in 1 Peter chapter 3, verse 18, that God's salvation story culminates in the person of Jesus Christ, in his death and resurrection. And the way Peter sort of puts it is, Christ suffered once for sins, the righteous for the unrighteous, that he might bring us to God. So Peter's talking about what sometimes we call this divine exchange, the innocent for the guilty, the righteous for the unrighteous. So then if we are a follower of Christ, we can confidently say that God is not punishing us, because that punishment was placed on his son Jesus Christ, and that our names are now written in the book of life. So that Paul has this declaration over us in the book of Romans that there is now therefore no condemnation for those who are in Christ Jesus. I think you guys know that passage, right? So see, if you are a believer and you have non-believers who are equally dying from COVID-19, it would be hard to suggest that this is somehow a punishment that comes from God, and that somehow these promises that we find in Scripture, that somehow they've been sort of taken back by God. So it doesn't make sense from that perspective. And if we say we are suffering because of loose morals, or all the abortions, or the gay population in your city, as some Christians like to say, but that is to suggest that somehow non-believers' sins, the result of non-believers in your community or in your country, is somehow causing believers to suffer and die. And nowhere do we ever see the Bible equate sickness. Nowhere do we see God equate sickness with actually sin. There's a passage in John chapter 9 where the disciples ask Jesus or Rabbi, who sinned, this man that he was born this way with this deformity, this blindness, or was it his parents who sinned?
Mm-hmm.
And Jesus, I mean, he couldn't be any more clear. He said, neither this man nor his parents sinned. And there was another incident in Luke chapter 13 where a tower was built, but it was poorly built, and it collapsed on the people who were there, and 18 people were killed. And so people were curious as to why this happened. So they asked, so who was more sinful? The ones who were are these people, are they guilty of more sin so that they essentially died from this accident? And Jesus there says, essentially, that they are not necessarily more sinful, and stop using disasters and devastations to pronounce God's judgment. And he sums up that passage simply by saying, just worry about yourself, repent. So I think you can make the case pretty conclusively that disasters or accidents or cancer or pandemics are not the result of God punishing or judging sinful people, but rather it's more of a sign of living life in a fallen world, that it's the consequences of a broken, sinful world. You might ask, then where is God at this time during the pandemic? Probably where he always is, close to the brokenhearted and the sick. God laments and grieves over his creation that was never part of his original plan. So rather than saying and asking questions, is this God judging us or punishing us? Instead, the pandemic should remind us. It should serve as a reminder, or even a warning, if you want to use a little more harsher language because you want that we are busily building our lives and our careers, all those things that charm us and bring us comfort and meaning. But we could literally die and be blown away like the chaff by a single wind. That our lives can be expunged in a matter of just minutes. That ultimately we don't hold control and sovereignty over our own lives. That our lives are fragile and it's also very short. And that really we need to make the most of the time that God has given us here on this earth. To redeem it, to recognize that it's a gift every day that God has given us the opportunity to live. So let's talk about crying out at this time. I say absolutely we should cry out. But cry out first and foremost about your own shortcomings. That seems to be always the formula. When there is a pandemic or there's some kind of national disaster, the Jewish people are called to come and repent of their own sins, to recognize their own shortcomings rather than pointing fingers or pointing to their enemies. So instead of pointing to people who might have caused this, or as a judgment against a group of people, which is totally not healthy, not helpful, consider the ways that we are so distracted. Consider the many idols in our lives. Consider the ways we treat God as though he's so much less than a top priority that he should be. And those are the areas that we need to reflect on. And we need to cry out to God for his mercy and ask that God would demonstrate his grace again. And then we are to call others to cry out by helping them to see the gospel of Jesus Christ for what it is. That it is the only sure foundation that one can stand on. In a way, I believe that we had this opportune moment, like no other time in our generation, to share the gospel. More people are asking questions and seeking answers than ever before. We are going to call them to cry out by sharing the gospel, by sharing our love that we have received from Christ. And we do it with respect and with gentleness, never pointing fingers, never condemning people, never calling out their sins in a way that drives them away from God. But we invite them to safe spaces where they can explore what it means to be a child of God and ask tough questions of our faith. And together we can be on this journey. And I think that's what crying out looks like for us today.
I feel like I just sat through 2 sermons, so that was really great. Thank you.
Yeah, move on from me. I get 2 sermon a year.
I had a quick question for you though. Why do you think it's like our natural propensity or like the human condition to blame God during the disasters or times of distress?
Yeah, I think we're always looking for a scapegoat. It helps us to kind of bring order to our chaos. And I think it starts from the top. If we can sort of pinpoint where this is sort of originated, and in some way we can kind of comfort ourselves. We do that with both God sometimes, blaming Him for things that don't go right in our lives. And of course we do it with family members and friends or relationships from the past where we have this tendency to blame them. So it gives us a reason and justification for our own shortcomings. I think that's the reason why.
Did anybody have anything else you guys want to add to it, or? All right, we're going to move on to our mental health professionals. Thank you, Pastor Charles. Okay, so Tiffany, can you share a little bit on the impact COVID has had on our mental health? Are you on?
Yeah, sorry.
There you are.
Yeah, I mean, I think we are definitely living in uncertain times, like we've been talking about all night or all day. We're starting to just see a lot of, or the questions that were posed to us. And even sort of what Hannah and I are seeing in our patients is just a lot of different emotions, right? We're seeing a lot of fear. We're seeing a lot of anxiety. There's a lot of depression coming out, probably stemming from a lot of loneliness and some of that unclear, like financial, questions that Ben was talking about. We're seeing a lot of boredom from people, just sort of not really knowing what to do with themselves. And then even a lot of anger and frustration, and that comes from being cooped up with a lot of people. But I think we wanted to at least start off and just, acknowledging that all of these emotions that we're feeling are completely normal, given what's going on in the world right now. And I think most of us don't actually know really what to do with our emotions when we're faced with them. A lot of us just tend to kind of, push them to the side, and we don't really think a lot about them. But I think that this is an important time to recognize them, that God gave us emotions really to gauge sort of what's going on, gave us emotions to feel, just the relationship, feel how we're feeling inside, and even to really ultimately help us respond appropriately to our circumstances. So, I want to give the example of anxiety. I think I've been hearing nonstop COVID and anxiety, how to manage your anxiety, right? And I think there's just this idea that anxiety is a bad thing, or that if you have too much anxiety, it's not bad. But I also want to highlight that anxiety is actually part of our survival instinct, right? It's part of our fight and our flight response. And so when you're faced with something that is potentially harmful to you. Right now we have an invisible disease that's potentially threatening our safety, the safety of people that we love. Our God-given instinct of anxiety is kicking in, right? And I think that that's something we have to recognize, that it's meant to alert us, and it also is there to help us prepare, like, how am I going to respond to this threat that's coming up? So I think that while these emotions are good, they are also not great if it goes too far, right? And if they start to control you. So this is where it moves from being just sort of this, automatic survival response to actually becoming a long-term mental health issue. So we kind of want to talk a little bit about that today. So Hannah is going to share with us just the mindfulness technique that I think can be helpful, in any situation, but specifically right now as we're kind of dealing with our increased emotions. So Hannah.
I forgot to unmute myself. So if I can have that next slide up as I'm talking, I think it'll be really helpful to follow along. So the reason Tiffany and I chose this particular technique is because I think it's not necessarily like specifics on how to change your emotion. So one of the most common questions that I get a lot of times when someone is starting therapy with me is like, how do I stop feeling something? Or I'm here because I can't handle my emotions and I need to know how to not be X, Y, Z, A, B, C, whatever. And, let me tell you, it's pretty much impossible to not have emotional reactions. And behavior is something different, but emotions are just knee-jerk reactions. If someone hits you on your knee, you're gonna, kick. So emotions are very much like that. But I think when we have a hard time when we think we have a hard time controlling our emotions, we start to characterize ourselves as, you know, am I weak? You know, or maybe in Christian terms, am I sinful? Why am I so sinful? You know, why are my emotions like this? Why do I have bad emotions? And so I think this is a different way to approach our emotions. A lot of times when I'm doing counseling, I try to really encourage people to view emotions as information sources rather than characterizing yourself in one way or the other. You know, it's information telling you you're experiencing something, you need something, or you need to change something. So we really need to be curious about that. So RAIN is a mindfulness technique, and I think it could be applied in this situation, but I think it could be applied to others. So basically, R is recognition, and recognition just means, you know, notice what's going on in this moment. Just step back and observe and put a name to any feelings or thoughts. So it may even be, you know, I think PC talked about this. I'm feeling a lot of grief right now. You know, I'm feeling a lot of sadness right now. I'm feeling a lot of anger right now. Acceptance. So this is something that I really notice people struggling with, especially Christians actually, because they don't want to accept certain emotions. They only want to accept good, you know, quote unquote, good emotions. But we have to accept all the emotions, even if it is unpleasant, and practice self-compassion rather than criticism. So rather than saying, it's not good to be feeling like this, I should be feeling, you know, grateful. You kind of just saying, you know what, I'm going through a lot and I'm feeling what I'm feeling. And I think it makes sense and I think it's okay. I is investigation. So that means that we have to try to be curious to what might be causing the thought or emotion. And again, what people do is they don't want to at first admit that they're having an emotion that they don't like, and two, they don't even want to think about why they're experiencing it, right? And it's just, you know, I'm fine, I'm fine, like I'm good. But then it comes out in all these other ways, right? If you're grabbing for like the fourth bag of chips that day, or you notice you're lashing out at other people, right? It's coming from somewhere. And rather than saying, I'm just so weak, we have to say, I wonder what's going on that's triggering this. I wonder what I've been going through that's making me feel this way. So that's what investigation is. And then non-identification is saying, I am not my feeling. So something that's simple that I encourage clients to say is using the phrase, I am having the thought, rather than so kind of saying, if I'm feeling anxious, I might say, I am anxious. But I would say, I'm having the thought that I'm anxious. Or I'm overwhelmed, I'm helpless. You would say, I'm having the thought that I'm overwhelmed or anxious. So what it does is it creates a slight separation between you and the thing that you're experiencing. You don't have to be everything that you're feeling, and you don't have to characterize yourself with that. And what it does is I think it really opens you up to be curious. And that's really the biggest step to kind of figuring out what to do next. If you're not curious and you don't want to face something, you don't want to admit to something, it makes really everything else really difficult. So I hope I made that clear-ish.
Yeah.
Okay.
So like
All
that
right.
non-identification part of it, it's like where you detach yourself from that emotion, and it's not like it's not like all of who you are.
Yes. So I am a person that has anxiety. I am a person that struggles with fear. I am a person. So I think I'm a person that struggles with jealousy. I'm a person who struggles with like hatred, right? So it doesn't mean I am a hateful person. I am a jealous person. And I think sometimes, especially with Christian clients, they're a little bit more black and white. And I think it really, they struggle with more self-compassion, which is funny enough, right? So yes, that's kind of the idea behind that.
So there's a question that came in, and it basically says, once people started working from home, my coworkers were working from 6 a.m. to 11 p.m. It's been very stressful to receive work messages out of working hours. I'm also starting to feel depressed, not being able to go out and seeing the sun, walk outside, or see my friends. I also notice that when I'm at home cooking by myself, I eat more than I need. And when we're having meetings online, I feel very tired, more so than face-to-face meetings. Do you have any suggestions?
Yeah, so I think the very first thing that I think of when I hear that question is boundaries. Like it just sort of screams out at me. And I think it's as we've shifted into this very, again, different type of world right now, everything is happening in the home, right? Like we used to be able to have these routines where you would leave work, you would leave home and you go to work, and then you leave work, you go to, X, Y, and Z. But right now everything is happening in this space, right? And so we used to be able to draw like physical boundaries when you would leave home to go to work, and when you'd maybe leave work and you'd go to dinner with your friends. And these are just sort of very physical boundaries that we used to put up. But I'll have to say that even though our routines currently have changed, I definitely don't think our boundaries should change, right? Like, and obviously every job situation is different. But when you're leaving your job physically, you start moving into this space that's your personal life. And you start to turn off the work questions and the work things, and you've left your job and you start thinking about, okay, what am I going to do for dinner? Who am I going to see? And it's this personal lifetime. And I obviously think that's really hard right now for people to do, because we're doing everything in the same space. And so, the one thing I would say is it's hard, but just because other people are responding at 11 p.m. really doesn't mean that you have to be. And I'm fully aware that even as I'm saying that, a lot of us kind of grew up in this shame or kind of guilt culture, where boundaries are really hard for us because, I think a lot of us have really strong work ethics, and we feel like we need to go above and beyond. But, as I've been thinking about that, what helps ground me, what helps me set boundaries is ultimately, I think about the fact that Jesus had boundaries, right? If you think about the way that he lived life, and he did ministry and he did work, he had a rhythm to his life, right? And so he knew that there were times where he had to rest and he needed to withdraw, even though there were hordes of people like always needing him. Like he set really appropriate boundaries for his life, and he knew when it was time to rest. He knew when it was time to insulate with kind of just his disciples and his small group of people. And I think that that's really him modeling healthy living for us, modeling healthy boundaries. And then also I think back to also what Hannah was seeing with the RAIN model, right? So when you're starting to feel these like feelings of, am I supposed to do this? Like this is that investigation piece, right? This is, being curious and figuring out like what's going on, paying attention to why are you frustrated, paying attention to where you're starting to feel the depression. And then ultimately, being compassionate and kind of giving yourself a break and saying like, you know what, I'm going to set my boundary and I'm going to wait until tomorrow to respond to that email. So that's kind of the first thought that I had.
Mm-hmm. Mm-hmm.
And I'm going to speak a little bit to kind of maybe managing the emotions and isolation. So I think that, oh, by the way, I didn't want to shame any chip lovers in my previous comments. I'm a chip lover, and I have a bag of chips in my work bag upstairs. And I know that when I'm reaching for it, something is happening, right? I'm like, oh, that was children. So I don't want to shame that. But I can say, let's be aware. Just like I try to be aware as I look into the trash bin of mini chips. Anyway, let's go back to the emotions. So I think, there's the piece about like, I'm noticing my emotions, I'm feeling more increasingly depressed. And not only that, I think there's going to be anxiety and worry and loss of agency. And again, a lot of this is coming out of, I think, the loss of control. Right? We don't have agency and freedom to be able to do the things we'd like to do. And it's gonna impact people in different ways, but ultimately it has to do with this. I think some of it has to do with this feeling of like, I don't have control over my life and I don't get to dictate who I spend it with. I don't get to see the people that I want. And I think a lot of times what we do in the face of unknown is that we fill it with fears and worst case scenarios. So it's our attempt to find control. And so what we think about is what would happen in this scenario, or what if this were to happen, what would I do? And so we kind of think we're regaining power by overthinking something, right? And I'm sure we've all done it, where we're thinking about all the different things that could go wrong, or we'll think about something that's already happened in the past, but then now we're thinking about it in this scenario, in this perspective. And this is just a common, I think, human desire for control. But what we'll do is we just kind of overdo it, and we shift the focus on things we actually can't control. And so if I can have that second slide. So, there are so many things not within our control right now. And as much as we have a right, and it's valid to feel what we feel about all those things we cannot control, and we should appropriately grieve those things and feel our feelings about them, I do think it behooves us to shift our focus to the things we can control as much as possible. And so, if you see in this diagram, there's like things outside of the circle. These are like what other people are doing, if they're practicing social distancing, how long this is gonna last. And then like inside the circle are things like, what's my attitude gonna be? Am I doing what I can? And Ben said this earlier, like limiting how much I'm seeing in the news or in social media, turning off the TV. And I think some of this is really gonna help you. The why is really because we want to regain control. And if we can focus on things that we actually have control over, even if it's small, even if it's, doesn't seem meaningful in the long run, like I may be like, the only thing I could do is if I could just become a doctor and go help people. Isn't that the best thing? But I can't do that, right? So, but if I can, deliver food to people, or if I can write somebody a letter, if I can kind of hunker down and focus on my finals, because that's really the only thing that I can do, and I better not mess up my own future because of what's going on. So the things that you can control, I think, is helpful. And I think that's also why it's really important to take this quarantine in chunks and not as a whole. I often feel very overwhelmed when I think about like, oh my gosh, how much longer is this gonna take? They said 3 weeks and now it's not, and when I hear different dates out there, like it's gonna be, things aren't going to be open until 2021, or when I hear things like that, it overwhelms me because I just don't think I can do this whole thing. But I think if you take things in chunks, and chunks could literally mean like just the next 30 minutes, the next day, or the next week. If you're like, I can do this task right now, and I can do that. You know what? I can get through this week. It will make things so much easier, just because then you can again get a sense of control. And I think about this with like having my children with me for this long. I can't believe it. Like I really was having some internal like panic, and not that I love my children, but it's like really hard.
Okay, all parents thought the same thing.
Yes, I'm like, oh my God. But I really, even initially when it was just supposed to be 3 weeks, I felt super overwhelmed. I'm like, 3 weeks? That's almost a month. And I know my math, right? So, but if you think about it, it's been 7 weeks at this point, right? So I think I actually had to count back to see how much that was, and I think if you're taking it in chunks, that could be helpful in this time as well.
Yeah, there's one more thing that, sort of in answer to this question that, we wanted to point out was this idea that recently came out over Zoom fatigue. I don't know if people have kind of heard about this. It's just been in the last week that it's been in the news. And, I remember when I moved my class from in-person to online, technologically it was not an issue, but lecturing for 2 hours is like usually no problem for me. But when I went to Zoom, I was dead. Like after 2 hours, I just would like pass out and have no energy. And I had no idea why I was feeling so tired, right? And I think it's because Zoom is currently what we're doing work on. We're doing small group on Zoom. We're doing classes on Zoom. We're doing our friend hangouts on Zoom. And there's just so much Zoom, right? And when they started, rolling out these sort of studies and these conversations about what's happening with Zoom, like it really kind of like blew my mind. And so what Zoom fatigue basically is that, there's just so much more that you have to animate and be when you're on Zoom, right? So if you think about it, when we communicate with people, about 55% of what we communicate is actually done non-verbally, right? So this is in the way that I look at you. When I'm looking at you in your eyes, I'm communicating to you non-verbally that I'm listening to you. I'm here with you, right? And usually, you know, even in our conversation, I might look away for a second, and that's just sort of like a break, right? But how do you look at 20 people in a gallery view, right? And pay attention to everything that's happening and everyone that's there. And it's exhausting, right? And there's also this idea that, you know, you're this little tiny head on this screen. And you're just sort of floating there. And like, I remember being like a professor and trying to like, I was gesticulating like crazy to just be like, pay attention to me, listen to what I have to say. And I just felt like I was spending so much more energy trying to compensate for the fact that I'm this tiny little flat person, but trying to still exude who I am as a person, right? So that takes a toll on your body. And the biggest thing that I really realized is, you know, when you're on Zoom, you see yourself, like you physically see this little picture, no matter what view you're on, there's always a picture of you. And there is that part where normally when you're talking to someone, you don't have a mirror behind you, right? That's like recording everything that you're doing. And so naturally, like as I'm starting to talk, I'm like, do I look like, you know, and then I start naturally like trying to fix myself. And those things, those little minute little details just really start to add up. And that's why I think we are so tired. We are all zoomed out, right? Like my kids, I'm like, let's get on with the phone call with your friends. And they're like, no, I don't want to, right? And I'm like, but it's your friends. And even them, like they understand that there is this fatigue. So I think in recognizing that, we again have to exert like that self-compassion, right? It is important. I think that we need to stay connected to the outside world. This is sort of the best platform that we have found to be able to stay connected. But here's the other side. Not everything has to be Zoom. Not everything has to be video. It's okay to make an old school call and just audio call and talk to each other, because that lets you multitask. That lets you, you know, have a break from having to look a certain way or look presentable. And I think those are all little things that we can do to sort of decrease this fatigue that I think everybody is feeling right now, and that's normal.
Yeah. Yeah, I just had my kids write a letter and do snail mail. They're like,
Yeah.
what's this?
They have no idea.
I know. All right, so the next question is, this person says, I am a newly married woman. We began our relationship long distance, and as soon as we got married, we have been in quarantine together and living with our in-laws. How do I remain empathetic, kind, and loving during this time when we are both experiencing many upheavals? How do I communicate well with my loved one and our family without snapping or shutting them out entirely? I know.
Well, I would say, I think when we got this question, Tiff and I looked at each other. We were like, I don't know.
I was like, you answer the question.
I was like, good luck. Well, I would say that, you know, one, be compassionate, right? Let's go back to that, because, you know, there's in this question alone, you see multiple transitions. Doing long distance, now you are face to face, breathing the same air day in, day out. And not only that, you have in-laws. There's multiple dynamics going on there that you've never had to, you know, deal with, and now you're dealing with it all at once. So I think there's a lot going on. I think what Tiff spoke about earlier in terms of boundaries, like that's the lack of boundaries, I think, not only just personal space, but navigating the new roles of boundaries is going on. And I think it's very difficult on a given day, on a new, like newlywed day with in-laws. But I think in this situation, it's just kind of like in a what do you call it? Instapat, right? Like it's just brewing together. Now, but if we're to go back to the RAIN model, I would say you acknowledge your thoughts and feelings with compassion and say, it's okay that I'm feeling frustrated. It's okay that in this moment I hate my spouse. You know, it's okay that it is a feeling that I'm having towards my partner, even though I love them. But in this moment, I feel this way, right? And then kind of, again, investigating with kindness, rather than saying, what a bad spouse I am, what a bad daughter-in-law I am, but just saying, I wonder what's going on for me, what's building up for me, and what is it that I need to do right now, right? Again, when I say this, I know it sounds like super easy, but I know it's not. But I'm saying that these steps help you feel like there's an anchor, right? Mindfulness, what it does is it helps you feel like I'm going somewhere. It's like if you have a ship that's tossing and turning in the wind, you just drop the anchor. And you drop the anchor. It doesn't mean that you're not tossing and turning, but you have somewhere to kind of keep you grounded so that you can have a place to think. So if as you're doing this and you recognize I've literally had no time to myself all day, zero, then maybe what the self-care could look like is just asking your spouse, I know you can't leave me alone. However, maybe as we're sitting next to each other in this bed, we both put our earphones on and just do something that just we like, right? And so I think sometimes people think of self-care as big things or it has to involve like face masks. So you don't need any of that. It just has to be something intentional for you, and it could be really short. But I think if we don't investigate, if we don't acknowledge that we are being triggered, then we can't take those steps. And the other thing is that even though we're not going to be perfect, we go back to the values. And I think PC talked about this, like what are the values and beliefs that we're going to be sticking to, right? So it's okay that it's not going to be done perfectly, but values are also the things that anchor you back. Okay, I struggled today, but what is it that I really want to be doing? Where do I want to end up at the end of this quarantine? Do I want to end up really having a really strained relationship with my in-laws, or do I want to feel like this time was meaningful? And again, not perfection, but we're saying what anchors or what values can anchor you to kind of come back after you've grounded yourself, after you've taken care of yourself. You can kind of say, okay, let's try this thing to go back to my values. Let's do this thing that's going to make me feel more in line with that. I hope that's making sense.
Yeah, and I also want to address like another thing that is important to kind of recognize is I think paying attention to what are realistic expectations that you have for the people that you're in, right? And so asking yourself like, what am I expecting from the people that I'm living this quarantine life with right now, right? And are those things realistic? Something that blew my mind was the educators of Tapestry put together this really informative webinar to help parents like navigate this season of distance learning. And I remember they put up like a slide and it said, the average first to third grader should really only be learning for about like 2 hours a day. And I was like, but they're in school for 6 hours. What are they doing the rest of the time? And I think so, again, that really just for me was like adjusting these expectations of what school looks like for kids, or even for your spouse. If you're home with your spouse and, normally so-and-so does these things, or one person takes care of all the household chores or does all of the things that run home, but you're all at home right now. Those are moments where it's easy to be like, why am I doing all the cooking or cleaning, right? So I think it's important for these conversations to be had in the home right now of how the home is run, right? And knowing that this is a different time. This is not normal. There was a period where, I was at home seeing my patients televisit. My husband was on calls and like someone had to make the kids lunch. And I was like, you do it. Like, and we were like fighting about it. And, I think it was because we didn't set like, what are the expectations? The expectation was that I normally do it, so I should continue to do it. And I'm like, but I have work too. So I think it's having those conversations and seeing this is a very unique time. We need to maybe reshift or rejuggle some of the household chores, the expectations of who does, laundry, food shopping, all of those things need to be discussed and kind of lower that expectation bar significantly. I have given up cleaning my house because, it's just a mess. Like 20 minutes later, I turn around and my kids have destroyed the house. So lowering my expectations has allowed me to be a lot more compassionate. And again, I think being self-compassionate regardless of your situation, right? Whether you're home with your kids and you have a lot on your plate, or even if you're single and you don't have a lot going on and you feel like you should be doing more, like don't beat yourself up. Just, kind of be compassionate about it, because I think we are all trying to deal with these losses and this struggle right now. So I think setting proper expectations help a lot.
Did you, Tiffany, want to talk about the rituals of family therapy?
Oh, right. That was in relation to the question, another question about college students. But
Oh, you want to...
if you want to ask the question, I'll answer.
My bad. So, are the strategies that you presented relevant to a college student who is grieving their graduation experience? How would it look like for them?
Yeah, so we've been getting a lot of questions specifically about like what do we do with missed graduations, missed weddings, funerals even. Like this is definitely again a very different time, and it's so hard when we can't. It's basically a loss in what we're calling rituals. Like when I do family therapy work, it's something that we call rituals that are important, and these are basically symbols, right? And I think if you think about a college graduation or any of these big markers, weddings, they are basically symbols of some type of accomplishment or a major choice in your life, right? And we don't have that. And so I think we have to sort of put on a different lens when we're thinking about it, in that, it's not going to be the same, obviously, right? But I do think it would be a mistake if people choose not to mark the occasion in some way, right? Whether that is still getting together, right? I had a bunch of my graduating students come to me and say, like, we're so depressed, graduation got canceled. And I said to them, what's stopping you still from getting together with your friends that you would hang out with anyways? Putting on, your cap and gown if you have it, or even like your school, sweatshirt or whatever it is, something that symbolizes what you're doing and really celebrating this marker that you're making together with your community. And again, it's not going to look the same, but I still think it's important that you mark this occasion and then you make a decision to celebrate and party later, right? When the restrictions are lifted, that it's still the symbolic point to not say, to just forget about it, that it didn't exist or it's just a lost thing. But I really think that that's something that's really important. And also think about the fact that graduations and weddings are not even only about the individual, right? Like we're celebrating as a community together. So like a wedding is a celebration of all the people in your life who have come together to support this relationship. And I think that that can still be done, again, maybe through Zoom, even though we don't, we're tired of it, but it's still important, right? That's why you're seeing all these birthday songs and all these things that are happening, because it's still important for us in the rhythms of our life to still have something. So that would sort of be something that I would recommend for people.
Mm-hmm.
And I think if I could add just one more thing, I work with a lot of college students, but I think this applies to anybody who's worked really hard for their work or career or that degree. And I think when they cannot get the job, like because the job market isn't great right now, or they lost a job, and I think when they've centered their lives around their identity being this thing, I think when it's outside their grasp, it can be really difficult, and it's a big loss. But I think it does go back to values again, right? So, and something I have to kind of encourage people to think about is, is your identity about having that specific job, or is your identity about like having, like working in a certain field? What about the actual like skills you've achieved? Those are still there, right? So even if you can't answer the question, what do you do for a living, or what are you going to do now that you've graduated, right? And it can be, I'm waiting, right? But to kind of revisit identity questions that are beyond just kind of the tangible things. And I know that's difficult, and I'm not saying that's easy, but I think that's the challenge right now. And a lot of times when counselors are working with people that go through trauma, what we move people to go toward is to find meaning in something. So even if it was traumatic or difficult, what is the agency that came out of that? What is it that you've learned? It doesn't take away the trauma, but what is it that helps us to move forward, right? And so I think this is a good opportunity for us to take a good look at ourselves, our homes, our communities, our nation, and it's an opportunity to kind of think about those kind of bigger questions. So I'll end on that.
Oh my gosh, so many good conversations. I wish we had more time, but that's all the time that we have. Really, all of these panelists can have their own webinars to flesh out how to approach this season with our best foot forward. But so thank you, panelists, for the time and the commitment that you guys put in to be here. So Hannah O or Hannah Lee, she gave us a condensed version of her talk, and she actually has a full presentation called How to Face COVID. So if you're interested in seeing the full version, please be on the lookout at on the Tapestry's website, app, or Instagram for more details. We also understand that this webinar didn't allow for more interactions with our viewers. So Gospel Care will also be hosting a Zoom chat with mental health professionals and our Gospel Care team to ask if you guys have specific questions that you guys want to ask. If there's certain things that you guys want to wrestle with and you want to get immediate feedback, or you want to consult with our team or our professionals. So if you're interested in our first Zoom chat, it's going to be on Tuesday, May 26th at 8 p.m. And then again, you guys can find more information on that later on, closer to the date. It'll be on our TAP website, app, and Instagram. So finally, if you guys can please fill out our feedback form. We'd love to hear from you. Your input will give us direction on how to move forward from here. So we want to hear what worked, what you want to hear that you didn't get to hear yet, what your needs are. You can't click on the link that I put on the slide to follow. Because I'm technology illiterate, but it will be available on our website and our app as well. So let me just say a quick prayer to close. But thank you guys for joining us. So Heavenly Father, we know that we are not alone in this pandemic, in our distress and in our pain and struggle, God. We know, Father, that whatever the enemy throws at us, you are working to make good of this time. That even in a pandemic, that you are working to restore our health, our relationships, our faith, just all the things that were maybe placed in the wrong foundation, that you are reworking and rebuilding our lives. And we know that it is for good at the end of the day. And so, Lord, I pray that with all of the wealth of information that we learned today, may it really go into our daily habits, and we can utilize it to really further your work to heal and make us whole and to restore us individually as well as on a societal level. So we thank you for what you are doing and what you are going to do. We trust in your mighty name. We pray all this in Jesus' name. Amen. Thank you for joining us. If you guys want to see this again, this is recorded, so you guys can go back to it later on. I'll see you guys later. Thank you.
Bye.
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 Bye, guys.